Okay, so if you have a partner, I highly recommend having them help you because you're gonna be a lot more comfortable. It's gonna be a lot easier for you, and it can help the tissues kind of even relax or stretch more. So we're gonna show you what that looks like. So I have my partner here. So I forgot to mention earlier, before you go internally, kind of to the knuckle, you can warm up the tissues around your vagina on the outside, right? So just even imagining this is the labia majora or minora coming on the outside and just rubbing those tissues help to increase blood flow, circulation, warm that area up to help kind of let these tissues relax more. You can do that for 1 to 2 minutes. And once you've warmed up those tissues and you're feeling more comfortable, your partner can then come down to the perineum, like I said, the tissue that separates the vaginal opening to the anus, and you can just gently load downward, right? We talked about everyone's gonna be a little different. If it's really tender, you can try only holding it for 10 seconds, getting off of it. If you're feeling okay, you can load it a little bit more, 30 seconds. It's just gonna depend on what you're feeling, and then now your partner's doing it, you can practice closing your eyes, doing some diaphragmatic breathing. Once they've loaded the tissues for about 2 minutes, then they're gonna work on the clock, right? Going from 3 o'clock and 9 o'clock along the vaginal opening to help stretch those tissues even more. And same thing as before, they're gently loading it. You're really gonna have to talk with your partner and let them know, oh, hey, you can do a little bit more. I'm not really feeling that much. Or, oh my gosh, it's too much. Please, gently back off. And even helping maybe put your thumbs over their thumbs is a great way to guide the amount of pressure. You can press downward and let them know that's exactly what I'm looking for, okay? So everyone's gonna be a little different depending on your partner. And same thing as before, they can go up and down from the perineum from 3 o'clock to 9 o'clock. And then they can may even get a little better at feeling and really feel, oh yeah, right there I'm feeling a lot of tightness, and they can hold it there. If you are somebody that's had more multiple childbirths and had vaginal deliveries where you've had tearing or even episiotomies which required stitches, you can have your partner come down on that area where the perineum is and do a little bit of even cross friction and break up some of that scar tissue. And same thing, this is gonna be a really sensitive area, so you may need to put your thumb on theirs and guide them in the amount of depth and kind of let them know maybe you're going up and down with the cross friction or like side to side. Highly recommend getting a partner to help you with perineal massage. It's gonna be more comfortable. You can recline back. Using a recliner is nice, or sitting up against a wall, because then your low back is supported and your abdominals, everything can relax, your pelvic floor can relax. And you can just focus on breathing and letting those tissues stretch. I hope this is helpful.